are strong. In a better world is where we belong. Join in the fight, be the voice of hope. How do we make things right? Let your actions show. Well, talk is not enough, just be the words you say. There are people dying while you hesitate.
If only one is hurting, we are all in pain.
If we stand together, we'll never fall again.
We can give someone a chance to live a better life, to see through better eyes. Join the fight,
So light a fire, take the spark around the world. Let the human spirit burn, and our voices will be heard. And we're not leaving anyone behind. Together we are strong. In a better world is where we belong. Join in the fight, be the voice of hope. How do we make things right? Let your actions show.
Like kinds of light in every dark corner, like floodlights crashing through the gate. Our voices ring loud, our spirits burn bright. With our action now, we determine how long this fight would last.
So let's walk the talk, till our feet leave landmarks in the sand, till our pledges become rhymes, kids will sing with a smile in the memorial of victory. We are 100% committed, we are honoring our pledges, so be 100% committed to ending the neglected tropical diseases. So are you with us? Because
we're not leaving anyone behind. Together we are strong. In a better world is where we belong. Join in the fight, be the voice of hope. How do we make things right? And we're not leaving anyone behind. Together we are strong. In a better world is where we belong. Join in the fight, be the voice of hope. How do we make things right? Let your actions show.
Être 100% engagé à l'élimination des maladies tropicales négligées.
mwetendeteka okubanga mutwala obulwaire bw'omusobola
অবহেলিত গ্রীষ্মমণ্ডলীয় রোগসমূহের অবসান ঘটাতে আমাদের শতভাগ প্রতিশ্রুতিবদ্ধ হতে হবে।
आए मिलकर नजरअंदाज शुदा ट्रॉपिकल डिजीजेस को खत्म करने के लिए 100% पर अज़म रहे।
Komitmen 100% untuk mengakhiri penyakit tropis yang terabaikan.
Make one maximum effort for the bege against Yamayama disease.
Be 100% committed to ending neglected tropical diseases.
A very warm welcome to this joint webinar hosted by World Health Organization and Uniting to Combat NTDs to mark World Neglected Tropical Diseases Day 2023. We're following on from last year when the theme called on us to all address the inequalities that characterize NTDs with a focus on achieving health equity. Now, after much diverted funding streams and setbacks caused by the pandemic, this year sees a renewed call for the need to increase awareness of and investment to end inequality and the poor health outcomes that allow neglected tropical diseases to take hold and devastate too many of the world's population. The theme for this year asks that we act now, act together, and invest in NTDs. I'm Patricia, Amira, your moderator, and before we begin, and for your convenience, allow me to briefly run through the session guidelines. There is simultaneous interpretation available in French, Spanish, and Portuguese. To activate this service, of course, click on the interpretation on the pop-up bar at the bottom of your Zoom page. Kindly be aware that the session today will be live streamed, recorded, and available to view online after it has concluded. So, as such, your participation is taken as consent. I'd like to remind our speakers who are joining us today to kindly keep their camera on during their panel, during their session, but to remain on mute until it's your time to speak. And of course, I'll endeavor to do the same. I know we've had a few technical hitches trying to join, but I'm sure those will be resolved over the next couple of minutes as we begin. I know it would be wonderful to know where all the attendees are joining in from. So we do encourage you to introduce yourself using the Zoom chat function. Just say hi, so-and-so from whichever organization and country as well. So social media hashtags to use are hashtag WNTD Day, D-A-Y at the end there. So hashtag WNTD Day. Beat NTDs, of course, and we've also got hashtag 100% committed, written out as a word, ensuring, of course, that you tag both WHO and combat NTDs as well on your social media posts. By way of introduction to this session, I'm pleased to announce that the Global Report on NTDs 2030 is now available to view and download from the WHO website. It provides an up-to-date assessment of progress across the 20 diseases and disease groups. It also highlights the first 2 years of implementation of the roadmap for NTDs 2021 to 2030, as well as set in motion what is needed for the year ahead. So let's get a visual overview of that report.
WHO and the global NTD community are working towards one goal: a world free of neglected tropical diseases. The launch of the new NTD roadmap for 2021 to 2030 was a turning point, but a changing funding landscape and unpredictable international context have led to challenges. NTDs continue to disproportionately affect the poorest members of the world community. 16 countries bear 80% of the global NTD burden. However, the number of people requiring NTD interventions has decreased by 25% over the last decade, falling by 80 million people between 2020 and 2021. More than 1 billion people were treated each year between 2016 and 2019, and as of December 2022, 47 countries had eliminated at least one NTD. But COVID-19 took a toll on community-based interventions and on people's ability to access health facilities. As a result, the number of people treated for NTDs fell by 34% between 2019 and 2020, before rebounding again in 2021. In 2022, WHO published 52 guidelines, tools and other information products to help the global NTD community. It continued to evaluate and approve new medicines to treat these debilitating and deadly conditions, working to ensure equity and human rights in NTD interventions. WHO works with countries to help put in place the actions and frameworks that will benefit their people. WHO wants NTD treatments to be sustainable, and is working with partners and donors to ensure this, building global collectives and platforms for advocacy. The last few years have been challenging for the global NTD community. Now, we need to reverse the delays and look to the future. We must invest in innovative operations and financing solutions that foster integration and cross-sectoral collaboration. We must boost global support for countries with the highest NTD burdens. And we must continue to facilitate country ownership and the sustainability of NTD programs through new approaches to financing and implementation. Together, we can foster sustainable interventions that will allow us to reach our 2030 goal of a world free of NTDs.
A consolidated document to help us understand the scope and rationale behind the call to act now, act together and invest in NTDs. I can see lots of messages coming in here. Kebede Deribe Kasai from SIF, joining from Nairobi. I also see Wendy Harrison from the SCI Foundation from the UK. As I said, I just encourage you to say happy World NTD Day. Put your name in the chat and let us know where you're calling in from or you're listening in from. Now, to situate things even further, let's turn to our first panel of experts to discuss the progress made from specific contexts. We have John Muriuki, who's the director for East, Southern and Central Africa with Sightsavers, Professor Margaret Japong, who's the director for the Institute at the Institute of Health Research and also the coordinator of the Center for Health Policy and Implementation Research at the University of Health and Allied Sciences in Ghana, Rajiv Manji, who is Joint Secretary in the Ministry of Health and Family Welfare in India, joining us. But first, we'll turn to Camille Baladjay, who is the Senior Health Program Officer, Disease Prevention and Control Bureau at the Ministry of Health in the Philippines, who sent us this response.
The Philippines is an island country located in Southeast Asia and the Western Pacific region. It has a population size of more than 110 million, and the number of islands is more than 7,000. The climate is tropical and maritime, and it is endemic for several neglected tropical diseases, with some having significant progress such as lymphatic filariasis, rabies, and leprosy, while others are still developing in terms of strengthening of interventions such as schistosomiasis, STH, foodborne dermatitis, yaws, dengue, and snake bites. Lymphatic filariasis was first recorded in the country in 1907, but it was only in the 1960s where control mechanisms were established after further evidence on its endemicity were reported during the malaria survey where LF cases were identified. In 1998, the country shifted from control to elimination following the World Health Assembly resolution calling member states to eliminate LF. In 2001, MDA was piloted, and fast forward to 2022, 44 out of 46 endemic areas among the 81 administrative units have already stopped MDA. COVID-19 has had an effect on the continuity of services, not only for LF but also for other NTDs. Conducting MDA and performing surveys were a challenge at that time. As the countries bounced back due to availability of COVID-19 vaccines and a better understanding of the disease, services slowly returned to normal. For the Philippines, the future of the health system is achieving universal health care and strengthening primary care services. From vertical disease programs, we shifted to life stages. It is a challenge, but also an exciting opportunity for integration and improving quality of service. The impact of these integrations are yet to be determined. Support from partners have been very helpful to the government in this transition period. Together, both public and private organizations are working hand in hand for a smooth transition while ensuring that targets are still met for diseases and health outcomes.
Great, thank you for that brief overview of NTDs in the Philippines. Camille, turning to you, John, and picking up on what Camille has just said, challenges being exciting opportunities. And with 2023 being such a critical year for NTDs, how do you see progress in your region? Briefly, what is to be celebrated and what challenges remain?
Hello everyone. Happy NTD Day. Thanks, Patricia. Very, very important question. And I would say befitting a time like this when we are all celebrating World NTD Day. Indeed, 2023 is a critical year for NTDs, but not only because we hope for many more successes like we have done in the last decade, but because currently everything is in the balance. The global community has already made massive progress towards the control and elimination of neglected tropical diseases. 47 countries have already eliminated at least one NTD. But with the COVID-19 pandemic siphoning resources, taking a toll on community-based interventions and people's ability to access health facilities, elimination targets are at risk. And we now find ourselves competing against many other global priorities. We urgently need to act now, act together and invest in NTDs to ensure that we can continue working towards elimination goals. We've made a lot of progress, particularly in the region where I'm based, East, Central, and Southern Africa, and more generally in Africa. Africa is significantly affected by NTDs. It accounts for around 35% of the world NTD burden. However, the continent has seen an incredible amount of leadership and progress over the past decade in ending NTDs. For example, in May 2016, the WHO Region Office for Africa created the Expanded Special Project for Elimination of Neglected Tropical Diseases, ESPEN, to accelerate eliminating NTDs in Africa by disseminating best practices, coordinating activities, and offering technical guidance where needed. Thanks to efforts like this, 20 countries in Africa have now eliminated at least one NTD. Sightsavers works closely with government and a network of partners to eliminate 3 NTDs across East, Central, and Southern Africa. That is trachoma, river blindness, and lymphatic filariasis. In my time as Sightsavers, I've seen Ghana become the first country in the WHO's Africa region to eliminate trachoma as a public health problem. That was back in 2018. And then the same disease was confirmed eliminated by WHO in the Gambia back in 2021. And more recently, Malawi and Togo was confirmed to have eliminated trachoma last year. This indeed is a great progress. There are huge milestones for the countries and their governments, but it takes a huge amount of work and collaboration to eliminate a disease like trachoma. Moving on, in terms of what we need to celebrate now, the integral part that government and ministries of health play in control and elimination of NTDs, not only are governments a key ingredient to eliminating diseases, their commitment and ownership are also vital in ensuring they remain on course to elimination of NTDs. But vigilance and commitment by all who play a part in eliminating NTDs need to remain high, from the global level down to community level. It's not only the job of the government, it's a long-term collaborative approach that will help us keep neglected tropical diseases eliminated forever. Financing the elimination of NTD has significant return on investment. WHO investment case for ending NTDs published in 2017 estimated that for every $1 invested in preventive chemotherapy, it brings an estimated debt benefit of affected individuals to about $25. Intersectoral collaboration is key to eliminating NTDs. For example, as clean water and good sanitation and hygiene prevent the spread of certain NTDs, Sightsavers and its partners work to join programs with these sectors. Collaboration rather than competition is vital in the fight against NTDs. Sightsavers and its partners have proven that by building coalitions and strengthening multi-sectoral partnerships with government, donors, and partners, the chances of elimination are higher. This is without challenges. I've talked about the progress, key milestone, but there are also challenges. We must keep making a case for people why they need to invest in NTDs and how this aligns with other global priorities. Right now, everything is hanging in the balance. We've come so far, but there's a real risk that funding could stop and so much progress could be lost. We need funding for every NTD, but Sightsavers are particularly concerned about funding for liver blindness. This takes long term in terms of treatment. It can span across decades, and therefore it is worth to achieve elimination in terms of funding, elimination of river blindness. More support for DRC, where funding and support for NTDs is now really stretched. It's the largest country in the Sub-Saharan Africa and the 10th poorest in the world, with an enormous burden of NTDs. MDA cannot stop unless there's funding to conduct population-based prevalence surveys, amongst other surveillance and reporting activities. Management of morbidity caused by infections, including hydrocele and lymphedema, is often unfunded. This prevents national programs from achieving the criteria for elimination, even when MDA stops. Activities that sustain elimination milestones continue to be a challenge, such as behavior change campaigns, data integration, and health systems strengthening. In conclusion, I would say investing in NTDs creates a ripple effect in society. Not only can it stop vicious cycles of poverty, pain, disability, and stigma, it can lead to benefits such as increased productivity, improved school attendance, and greater empowerment for women. NTD elimination programs are transformative and demonstrate outstanding value for money in global health. By eliminating NTDs, we enhance the health, quality of life, and long-term well-being for millions of people affected by these conditions. The control and elimination of NTDs will allow health services to redirect resources to other important needs. This is why we must act now, act together, and invest in NTDs. Thank you.
Thank you so much for stating the situation so succinctly, John. John mentioned Ghana there, so we're turning to you now, Margaret. I'm sure you'd agree that challenges provide an opportunity to collaborate. Tell us how you see, and of course we know there's been much progress in Ghana, but tell us how you see the progress so far. What are the key challenges that are being faced, particularly in generating the research needed for critical gaps? Margaret.
Thank you very much, Patricia, and happy World NTD Day to all of us. Indeed, having been part of the progress of working to put the roadmap together and seeing its launch has really been a great pleasure to see how widespread it has been disseminated globally and how even at country level it is being used to develop master plans and investment cases. At least in Ghana, for the first time, I've seen our master plans go out really quickly with our investment cases put together. So in the last 2 or so years, how do I see the progress that has been made? And this is to Mwele, if she's listening. I remember she used to say, we need to advocate, we need to advocate, we need to let people hear about it. And I think the advocacy around the launch of the roadmap has really, really paid off. Today we are celebrating World NTD Day. It's the 3rd of its kind, and we are one of 12 global health days and weeks. It's all adding to the awareness creation and advocacy on NTDs. And in my university in Ghana, everybody is geared up to make sure that this happens. So this is quite a bit of progress that I see. Of course, we have the Kigali declarations, and the signatories have committed to the achievement of the SDG 3 targets on NTD and to the delivery of the 2030 roadmap, ending the neglect to attaining the sustainable development goals. And for me in particular, it was heartwarming to engage with academics, because in coming up with the Kigali Declaration, different stakeholders were engaged, and I was part of the group that engaged with academics. And the joy and excitement of being involved right at the beginning is something that shows the kind of progress we are making. So you have academics committed to working with programs, policymakers to ensure the delivery of the targets and milestones of the goals. Of course, it has been said that countries have certified or validated at least one NTD in 2022 alone. Ghana was mentioned for trachoma, but just at the end of the year, we also eliminated HAT, for which I'm quite proud. And I think my president will be talking later in the day about some of those things. Yeah. But more importantly, working on female genital schistosomiasis, I've seen a lot of progress towards engagement and working across partnerships and across sectors, which is one of the pillars of the roadmap, to ensure that we are working together outside our comfort zone. So working in female genital schisto, we've seen family health come on board, we've seen HIV/AIDS come on board, we've seen school health come on board to work to deal with an NTD. And I think that has made things really go well in trying to raise more awareness about some of the NTDs that we deal with. We've seen quite a lot of effort also from countries trying to include neglected tropical diseases in routine service delivery and contributing data to routine health management information systems. We could do better on that, but at least it is happening. It never used to happen but it's happening now. In terms of the key challenges, of course, COVID struck. We saw delays in the delivery of MDAs and other community-based interventions, and it affected the implementation of some research studies. Of course, our institution also suffered FCDA cuts, and it brought an abrupt end to one of our very important grants. We are still picking up the pieces from there because we had to engage the communities and they're asking what happened. But then one of the other challenges I see moving forward is non-engagement of communities in the timing and delivery of mass drug administration. In the early 90s, there were studies on community-directed treatment. These days, you find out that the timing and delivery of interventions at the community level is done depending on when funding arrives, and the community is not really involved. And some of the studies we have conducted have showed that this is a challenge, and communities really want to be engaged and to feel a part of the entire process. Another challenge I see is that our governments are still really heavily dependent on external funding. And one of the pillars of the roadmap is to ensure that there's country ownership. So, I mean, we look forward to seeing our countries taking more ownership and committing a bit more domestic resources to the fight of NTDs to ensure sustainability. The low level of integration of NTDs in routine service delivery is something which is also of a challenge. Otherwise, our health sector continues to see NTDs as a standalone rather than a part of the entire health system. If it is not done, it will not get the needed attention in the service, in the Ministry of Health. So then what research is needed? I think currently there are several research areas, but let me just pick on 4 issues. First of all, the gap between the burden of disease for NTDs in children and research devoted to this population. Most of the research we do focuses on adults, but if you take some of the work I'm doing on genital schisto and the distribution of praziquantel for schistosomiasis, children who are out of school are not really targeted that much, even though there's the drive to go in that direction. We need the pediatric formulations, and I know a lot of work has gone into getting these things out, but we need a lot more in that area, looking at NTDs and children. And then also developing of more and better medicines, diagnostics, and other tools to fill operational gaps. So there are tools and diagnostics, but we really need more to be able to deal with, especially some of the new NTDs that were included in the list. Of course, there's the need for also systematic screening or monitoring and evaluation for resistance developing in NTD programs. We don't talk that much about it, but anything could happen. In certain places, some of it is being reported, but we need to have systems to monitor and evaluate these. And of course, with my background in implementation research, I think there's the need for us to delve in more and for researchers to work better and closer with program managers as they identify challenges in deploying their various interventions that they have. Let me end it from here now. Thank you.
Thank you very much, Margaret. You know, you've heard there in-country ownership and resources. Of course, that's important. And the gap between research and children. I don't know, what does a picture look like in India, Rajiv? What's working? What are, you know, the current obstacles that you're facing there, Rajiv?
Thank you very much. Hello, everyone. With regard to the current situation in India, before I deliberate upon the questions, let me give you a preview that 20 tropical diseases are called neglected primarily because they are largely absent from the global health agenda and enjoy little or limited funding. I would therefore congratulate WHO for selecting a pertinent theme for the webinar while observing neglected tropical diseases day 2023. And the theme is Act Now, Act Together, Invest in Tropical Diseases. So my compliments and my best wishes to WHO for this. Perhaps to my limited understanding, I believe that even major pharmaceutical industries don't take much interest in the area of tropical disease medicines treating tropical diseases, because these diseases primarily affect the marginalized population of various countries. However, India, with its overall development agenda of the country, does not consider these 20 diseases as neglected. These diseases have engaged focused attention of the government of the day. India has geared up to work towards control, elimination, and eradication of major neglected tropical diseases ahead of Sustainable Development Goals target of 2030. Out of the 7 diseases which are prevalent here in India, I shall be speaking on the country's progress, as has been asked by Ms. Patricia. So I would be giving the overview as to what have we done by now and how we are moving towards that. So among the 7, the 3 are having a huge burden. I would be talking about leprosy, I would be talking about lymphatic filariasis and visceral leishmaniasis. During the last few years, India has recorded significant reduction in leprosy cases, lymphatic filariasis, and visceral leishmaniasis. However, India's contribution to global burden of leprosy is still around 54% if we compare with the current data. Lymphatic filariasis is around 52%, and visceral leishmaniasis is around 10%. With a view to address these concerns, new sets of strategies have been put in place to accelerate the process of elimination or eradication of these 3 major NTDs. India is on the verge of eliminating visceral leishmaniasis as a public health problem by the end of 2023 itself. And this can be evident from the fact that this disease, visceral leishmaniasis, was prevalent in 633 sub-districts, what we call here blocks, and it has come down from 633 blocks to 1 block only, to 1 sub-district only. And we are almost on the verge of eliminating visceral leishmaniasis. And very shortly, we shall be submitting our dossiers to WHO. So, of course, it will be eliminated as a public health problem. And what we define that, the prevalence, incidence of prevalence less than 1 per 10,000 population in those blocks. So as public health problem, we shall be eliminating this disease, visceral leishmaniasis. And we would be happy to share the success story we had, how we, designed our strategy and how we are moving towards that. 13 January 2023 will go down as a landmark day in India's fight against neglected tropical diseases, and particularly lymphatic filariasis. On 13 January 2023, Honorable Union Minister of Health and Family Welfare declared that India was committed to end lymphatic filariasis by 2027, 3 years ahead of the global target for eliminating this disabling neglected tropical diseases. Lymphatic filariasis, we have started a different mode of mass drug administration. Usually in case of DA, we used to cover 65, we are going to cover even more than 65% of population. For IDA, we are targeting almost 95%. So this time we are not going to miss the bus. We are not going to give a slip to this, and we have been working at different level. Not only intrasectoral, it is also intersectoral. Sometimes a doctor looking for a particular disease would also be sensitized to be careful to the lymphatic filariasis, to be careful to the post-Kala-Azar dermal leishmaniasis or post-VL dermal leishmaniasis. So all intra-sectoral coordination has also been strengthened. As it is known to the world about leprosy, that India eliminated leprosy as a public health problem in the year 2005. But this was at the national level, not at the sub-national level, not at the district level. So that posed a major, concern for all of us, that why we can achieve this target at national level. When we went down to the state level or district level, the situation was really serious. So from 2005 onwards, we have been working, but from 2002-03, today only we have launched the new strategy for eliminating leprosy as public health problem, again by the end of 2023, at the district level and sub-district level. It is going to be a major challenge. Although the prevalence rate has come down from 0.69 per 10,000 population in the year 2014-15 to 0.45 per 10,000 population in the year 2021-22. Grade 2 disability has also come down from 0.71 per million in the year 2014-15 to, that was 1.71 per million to 1.54 million, 1.54 per million population. So these data do speak about the achievement we have made, but that may not be sufficient for a country like India. So we have to really work hard, and India has embarked on elimination of leprosy by 2027 again with its revised strategy. This has been done primarily keeping in view that in case something goes wrong, some challenges we are witnessing in terms of lepra reaction, we are witnessing challenges in terms of antimicrobial resistance. So all these challenges, we have also started working on research, and the organizations, they are working on research. We have developed standard operating procedures as to what to do in case of lepra reactions at the local level, primary health centers, and what to do in case of antimicrobial resistance. So with all this strategy put in place, India is working hard to ensure that first we are able to eliminate these 3 major NTDs from India, and we would be happy to support the endeavor of WHO. WHO has always been supporting India technically, and we acknowledge your support.
Rajiv, very interesting what you're saying here. We've got Aparna coming in a little bit later, and I'm sure she'll be able to expound a little bit more on what you've mentioned.
Just 1 minute, I'll conclude. So 1 minute, I'll conclude. So while concluding my speech, I would like to state that for the world, these diseases are neglected tropical diseases, but for India, these diseases are prioritized tropical diseases for control, elimination, and eradication as public health problem. And this will be done well before SDG goal of 2030. Thank you very much.
Thank you so much for that, Rajiv. I do like that, prioritized tropical diseases. And thank you, of course, to all our panelists for their incisive contributions. And before I introduce our next set of speakers, and I think I mentioned Aparna will be coming on, let's pause a moment to watch this brilliant animation from Uniting to Combat NTDs.
In 1967, 150,000 people from 73 nations united on a mission. For 12 years, they braved floods and civil wars. Their success hung in the balance more than once. Then came a day, just like every day before it. A Somali man called Ali Mal Marlin caught smallpox. He would likely join the 500 million lives already claimed. Or if spared death, then blindness or disfigurement would be his fate. But this was no ordinary day, because Ali was the last ever victim of smallpox, and he went on to make a full recovery. Through an extraordinary cooperative effort, the world had achieved the impossible. For the first time in our history, humans eradicated a disease. we can also make history by ending neglected tropical diseases. Because neglected tropical diseases can be treated, and they can be prevented. Incredible progress has already been made, with neglected tropical diseases being eliminated in country after country, creating positive waves for millions of people. COVID threatened to stall our hard-fought progress, but we can get back on track. We have the medicine, we have the partnerships, we have the plan. We can make history and put an end to neglected tropical diseases in our lifetime, and lift over 1 billion people from misery to hope. All it will take is our 100% commitment. So let's act now, act together, and invest in neglected tropical diseases.
Yes, and here's to more extraordinary days like the one Ali experienced. And as we've heard and just seen, you know, yes, there's excellent work, but the rationale for investment appears crystal clear. Allow me to introduce our next group of speakers, Dr. Sosé Fall, who is the new director of the Global Program for Neglected Tropical Diseases at WHO. We also have Aparna Srikantam, who's the Director of Research at Lepra Society. From the End Fund, Sam Mayer, the Vice President for Public Affairs at the End Fund, of course, and Shomi Chowdhury, who's a board member at Youth Combating NTDs and a water, sanitation and hygiene activist, has sent in a message. And last but not least, Dr. Satoshi Ezo, who is the director in the International Cooperation Bureau at the Ministry of Foreign Affairs in Japan. A very warm welcome to you all. Dr. Fall, books have been written about the benefits of a fresh perspective, and joining the NTD community as you recently have, what do you see as the arguments for investment so far?
Thank you very much, Patricia. Good afternoon to all. Also, good morning and good evening to people connecting from different time zones. I would like to start by wishing a happy World NTD Day to all of us. This is, as you know, my first one as director of the Global NTD program in WHO. I'm very happy to be celebrating with you today as a member of this passionate community. I would like also to pay my respect to my predecessor, Dr. Moelle Manisela. She was not only an exceptional global health leader, but she also provided us an excellent vision for our work, the 2030 NTD roadmap, which was so expertly brought to fruition with contribution from all of you here today. And I feel very much that we owe it to her and to the communities we serve, ensures that we deliver on the NTD roadmap targets. I know many of you, many of us are missing Moelle dearly. She was a remarkable person, remarkable presence, and an inspiration to all who met and knew her. I'm starting out on my new own NTD journey as director of this global program, but already I can see quite clearly that while we may have a community full of commitment and dedication, we do not yet have the required investment to deliver on the job. There is, however, no doubt that the argument for continued and sustained investment in neglected tropical diseases is in own right, is powerful and deep compelling. NTDs capture communities in the cycle of poverty, but through community-led intervention, communities can be released and empowered to live more purposefully and fulfilling lives. Notably, NTD intervention have been shown to be associated with high cost effectiveness and high return on investment. But we can make them even more efficient and sustainable with strategic investment in key areas such as diagnostic, monitoring and evaluation, access and logistics, by fostering integration, packaging, mainstreaming, cross-cutting actions and cross-sectoral approaches, and by promoting country ownership, including through strong advocacy for domestic investment. But the economic argument is not the only argument we have to make. Investment in NTD really is an investment in a wider global health agenda. We have programs and interventions that already reach some of the most isolated part of our world community, some of the most remote areas and communities where NTD intervention may be the only contact the people living there have with established formal health care. It is up to us to leverage that power and reach and return it onto something generally transformative. We know that NTD platforms and programs are playing a significant role in the drive toward agendas such as universal coverage, health security, and so on. I want the decade to 2030 to be the one in which we bring this to full scale. In the changing landscape, we no longer have the luxury of siloed thinking or actions. We must work more efficiently and more collaboratively. Through cross-sector working, we enhance both the work that we do and our ability to secure investment. Before joining the NTD program, as you know, I work in health emergency, where the focus was also on multiple diseases affecting marginalized and vulnerable populations. And in that field, we learned that the value of talking and working with one voice, a united and strong voice, what we can accomplish together as a community will always be greater than the sum of our individual parts. We heard in the first panel about the progress we are making. This is, of course, excellent news, but we need to accelerate and we need action too. Delivering on the 2030 roadmap target will be far from easy. And if you are present today, it is because you already know them. But it will be worth the effort for the billion of people who stand to benefit from action we can implement. I want to thank everybody today and everyone in the NTD community for the welcome you have given me. And I look forward to a close and fruitful working relationship. Thank you.
Thank you, Dr. Pauline. As mentioned, turning impassioned commitment and dedication to also translate to investment to eliminate these diseases of poverty. Now, central, of course, to the roadmap are the people and communities, as you've just heard. And as I turn to you, Aparna, first, I hope you had a good day marking World Leprosy Day yesterday. But to your question, you have extensive experience both in research and administrative, and with leprosy specifically, which has its own specific requirements in terms of approach. It'd be good to hear your insights from a community perspective and the importance of sustained investments in NTDs.
Thank you, Patricia. Hi, everyone. And today it is very auspicious to be happy with all of you, the global community of people interested in NTDs. I really would like to wish for a day that we all celebrate, that World No NTD Day. I hope we all will be looking along with the roadmap. At the end of the road will be that. And yes, I do agree. And before that, I would like to thank the United to Combat NTDs and WHO to make this a very important topic on investment. And my predecessors and all the previous speakers have already set the tone that how is important the investment and various aspects. Especially, I would like to take the cue from Dr. Fall, where he mentioned the integration and also the participation and advocacy. So from a community perspective, that's what I'm going to bring as a response from our community. So here today, I'm also representing the Disease Management, Disability and Inclusion Group, which is a community-based group working along with NMM. When you see investment into NTDs, we all understand that it is more like towards a road map of WHO, which is more people focused. We know because it is of its multi-sectoral approach and integrated approach has always put the people under the center of its focus. However, here, the people who are affected by NTDs are to be looked at not just as a whole of their disease, but they are like, they have the consequences of all other aspects the diseases bring to them, including the geopolitical issues, socioeconomic consequences, problems like stigma and all these things. So when we think of the investment from a community perspective, we have a lot of possibilities to make it a more sustainable and effective investment. But a few of them I am bringing it today. One of them is an inclusive healthcare. We know a sustained investment into healthcare makes it more inclusive, especially in order to make it more appreciative and accountable of the various divergent needs which are across the NTDs. So as we know that the group of NTDs, each may be having its own, but collectively these NTDs have a lot of very special needs and divergent needs. Sometimes they grow across the cultures and various aspects. Accountability is also very important at the grassroots level because the community workers, these are the people, the healthcare workers who work in the community at the grassroots are the persons who are the first point of contact. So they also have to be made more accountable in delivering all the services that are relevant to NTD. Apart from this, it is very important to make all the NTD care more available and accessible at the community level. That includes preventive therapies, diagnostics, treatment, and more importantly, the post-treatment chronic care, for example, wound care or disability care, which is cross-cutting across many NTDs. That is very important as far as the inclusive healthcare is concerned. And one more important aspect of investment is to make the communities more participatory. All the decisions should be made while involving the communities. And they are not just at the grassroots level or the implementation. It is at all several layers of the NTD system, the community should be made more participatory or inclusive investments. And very important aspect is the integration. I'm glad that Dr. Fall has already mentioned this, but I would like to make it a very special mention because integration is the key to making it more an effective investments. For example, the integration can happen across the NTDs, and sometimes it can also make it through learning from other diseases. For example, some of the non-communicable diseases can also share their experiences. For example, wound care and foot care is common in diabetes and leprosy, LF, and many other diseases. And lymphedema, which is common and which has a lot of resources in breast cancer and some other malignancies, can also be cross-learned towards the lymphedema, lymphatic filariasis, and other such diseases. So this should not be a kind of a siloed. The investment into NTDs is also through investing in knowledge, resources, and also the cross-learning. And it is one more important aspect is while making it more participatory, there should be also addressed the community's needs, especially from the barriers that they most of the times they follow. These are the barriers of communication and language. Especially for the communities from Global South, it's very important these barriers also to be taken out. So they have to be removed to make it more participatory, more integrated, and more inclusive approach of investment for NTDs. Finally, I would like to sum up that investment in NTDs should be looked at through inclusive healthcare integration and community participation is an investment in reduction of poverty, allowing people to lead healthier, more economically productive lives for themselves and their families. In conclusion, sustained investment on NTDs leads to more focus on those particular set of diseases, so that one day they will no longer be neglected, and in a remote, they no longer exist. This is what is a perspective from the community of the people affected by of the NTDs. And as a researcher, this is a collective input from all our community. Thank you very much.
Very clearly put there, Aparna. Thank you so much. And of course, also, as we heard in the WHO report video earlier, these innovative approaches, just like Aparna's been mentioning, to financing and implementation is key. And of course, the End Fund have done an incredible job to date, raising resources for NTDs from private philanthropy. So from your experience, Sam, how can we bring in new donors to NTDs? Plus, given that you also have a funding model in which you co-invest with country governments, it'd be good to briefly hear why that is important to you and your donors at the End Fund.
Thank you, Patricia. Firstly, thank you to everyone. The End Fund is delighted to be here with you all. Thank you to my fellow panelists, Dr. Sose, for your leadership. And Aparna, I just want to echo so much of what you said. I think you've essentially laid out a language that we all, from all of our perspectives, need to be incorporating into the work that we do in the sector. And so just to thank you for highlighting the areas that you did. Patricia, when it comes to engaging more donors in the space, there's of course no simple answer to this. But I think drawing on the End Fund's experience working with philanthropists, there are some fundamental approaches I think are very important. The first is to present the right investment hypothesis. So to do this, we need to understand the motivations, of course, of any donor, but a critical element is the context in which they're considering a potential investment. So, for example, today we have a robust and growing community of philanthropists in the space who not only invest individually to fill gaps, keep treatment cycles on track, test innovations, areas that are perhaps within their own personal realms of interest, but they also look to engage with and learn from and co-invest with and maybe even motivate each other to do more. Our community of philanthropists, they're continue to look for opportunities to work together. They're driven, I think, by the deepened trust that they have with one another, and especially their significant experience now in achieving more impact together than separately. And this, Dr. Sose, gets to the point you made about us collectively being more than the sum of our individual parts. And I think for a donor standpoint, a fundamentally important element is the role played by the pharmaceutical companies in our sector and how their donations offer huge leverage opportunities to incentivize donors and philanthropists. It's been 35 years since, for example, Merck's original Mectizan commitment. And today we're seeing Senegal's announcement of their extraordinary progress in the fight against river blindness. And that brings great hope that perhaps Merck's donation will no longer be needed in some areas of that region. And that allows philanthropic co-investments to eventually be channeled elsewhere for greater impact. And today we're also seeing significant evolution in the corporate social responsibility space, with companies recognizing more and more that the well-being, the productivity of the communities who contribute to their value chains are directly impacted, they're held back, they're limited by NTDs. And so that offers more incentives for companies to engage. But in terms of how we present these investment opportunities to investors and to the champions, I think, who can influence investors, there are two fundamentally important ingredients. The first is a robust evidence base. So accuracy, of course, breeds credibility, and where we are quantifying the burden of disease, the cost of service delivery, even the cost of inaction in a certain context, the more up-to-date, the more relevant, the more comprehensive the data that we're using are, the more compelling the argument's going to be. And for example, I've been thrilled to see that today, Nigeria's Federal Ministry of Health is launching its new 5-year NTD master plan alongside the launch of a new report by Deloitte in Nigeria that has, in a very sort of up-to-date manner, calculated the economic and social returns on the investments that will help bring the targets in their master plan to life. And a second element here, which is equally, if not more important, and this gets to and should be infused entirely by so much of what Aparna just said, is storytelling. I think when storytelling is done well, it not only, and I'm echoing Aparna, you here again, it not only should center the dignity, the experience of those whose stories are told, but it should also genuinely shine a light on the toll, the reality that NTDs take on people, their families, communities, but it should also bring us hope. And it certainly, from an investor standpoint, it should allow investors to envision what might be possible with their support. It should be creative and it should inspire their action. And a great example of that will be seen actually this evening at the United Nations in New York with the unveiling of a new body of fine art photography led by Ethiopian artist and activist Ida Mulina called Reframing Neglect. And this is a collection that has already activated leaders from across the realms of politics, finance, sport, and the media. And you asked about the funding model of co-investment with governments. I mean, to the end fund, this is fundamentally important to our approach, and frankly, the only way that we will contribute towards the local ownership and the sustainability of NTD programming that is highlighted in the NTD roadmap from WHO. And although government contributions, I think, are rarely quantified in enough detail for external audiences, it's clear that the financial, the human, the infrastructural investments made by governments, they set the foundation for any NTD program. And it's only when we're better able to quantify those investments that we can more effectively negotiate and set expectations around greater contributions in the future. A great example here is the work currently being done by the government of Kenya to do this quantification work so that we can improve the clarity with which we're coordinating philanthropic investments with government, and then more accurately and effectively advocate for the greater domestic resource mobilization that's been talked about today.
Wow, so much that's been mentioned there, but I like that you brought in that whole art aspect. I mean, that's something that's close to my heart, but it just to use and work with all sorts of different sectors. But you mentioned meticulous data, hopeful storytelling done well, to inspire action. I mean, these are really heart and mind type important points. But of course, there's been the mention of silos by a few of the speakers. Let's turn to Shomi Chowdhury now. Can you tell us why investments in NTDs are critical, but also an investment that is also an investment in other agendas? Chowdhury, just come in there.
Investment in NTDs is critical because the lives of 1 billion people worldwide are dependent on it. The NTDs unfairly tax the world's most marginalized groups in terms of their health and finances. It is both economical and equitable to fund initiatives to combat NTDs. The return on investment is manifold. However, we need to get past our silo mindset and take a collaborative approach. In addition to NTDs, it's critical to invest in other agendas that are intimately related. For example, water, sanitation, and hygiene, WASH, is a vital tool for managing and preventing NTDs. Sanitation is important for preventing exposure to diseases such as the soil-transmitted helminth infections, schistosomiasis, and trachoma, while clean water and hygienic conditions in households and healthcare institutions are crucial for managing and treating many NTDs. 2 billion people still lack safe drinking water. My organization, Awareness 360, works with last-mile communities where marginalized people, particularly women and children, continue to suffer from diseases due to lack of WASH facilities and awareness, including the NTDs. Investing in WASH not only helps them prevent diseases, but also thrive economically. Similarly, NTDs run the danger of being accelerated by climate change because variations in climate, relative humidity, rainfall, and temperature have a direct impact on them. Just a few months ago, my country, Bangladesh, saw the second largest outbreak of dengue since 2000, with the largest having occurred in 2019. Last year's high number of dengue illnesses is being attributed to unusually heavy rains since June 2022, together with high temperatures and high humidity levels that have led to an upsurge in mosquito populations across the country. Warmer temperatures and extreme weather events frequently give vector-borne diseases additional chances to flourish. So investing in climate action will also contribute to the fight against the NTDs. We also should invest in young people. There is a significant funding gap when it comes to youths and youth-led initiatives. Youth Combating NTDs, for instance, is setting an example of meaningfully involving young people by building their capacity using storytelling, technology, and creative media to shed a much-needed spotlight on this movement and championing concrete actions on the ground. That's why it's so important that we think and act holistically. That way we will see a multifaceted impact which will contribute to not only the elimination of the NTDs, but also to other global goals. Thank you.
Sorry, Patricia, we can't hear you.
Patricia, you are muted. Can you unmute yourself?
It's amazing how 2 years later we still get this wrong, but thank you so much to show me meaningful, engaging of the youth in NTD elimination strategies, and I couldn't agree more with her there. So she mentions multifaceted impacts, which of course is best supported by robust health policies. Dr. Satoshi, your perspective on the rationale for investing in NTDs is pertinent here. Why now?
Thank you, Patricia, and thank you, WHO and the organizers for this opportunity. So I'm Dr. Ezoe, representing the Japanese government, but also representing an initiative called the Uniting Efforts for Innovation Access and Delivery. So from the perspective of human security. So we strongly believe that health systems must be able to effectively respond to and overcome health challenges to meet the Sustainable Development Goals, especially when many of the goals are way off the track due to COVID-19. So coming back to your question of why NTDs, so simply put, because there will be no UHC without addressing NTDs, so that we can make sure no one is left behind. So Japan has invested in multiple initiatives and partnerships leveraging G7, G20, and other key forums. But I just like to highlight two important initiatives for NTDs. One is the GHIT Fund, or Global Health Innovative Technology Fund, EP, that UNDP is spearheading. So the GHIT Fund invests in R&D for health technologies for NTDs, and the rationale for this investment is that NTDs are grossly under-researched, under-treated, largely due to underfunding, despite affecting more than 1 billion people every year. The GHIT Fund aims to close the gap in R&D for available technologies, especially those from Japan. And the second one is the Access and Delivery Partnership, ADP. And through this, UNDP, WHO, TDR, and PATH work with low and middle income countries' governments and partners to strengthen health systems and build capacities along the value chain of access and delivery to increase access to health technologies that address NTDs, TB, and malaria. So Uniting Efforts for Innovation, Access, and Delivery that I mentioned is a global platform established in 2019 by the government of Japan, GHIT Fund, and ADP by UNDP to bring together funders, innovators, governments, and other stakeholders across the R&D, access, and delivery continuum to discuss and try to find solutions to the changing challenges affecting access to vital health technologies to eliminate NTDs. So for example, we are proud to be working with the WHO on a toolkit for NTD national investment cases to support LMIC's governments in their investment and overall national responses with sustainable financing. And lastly, I just want to highlight that that's committed to highlighting NTDs in the context of UHC. So once again, no UHC without addressing NTDs. Happy NTD days. Thanks.
Thank you so much, Dr. Satoshi. Compelling perspectives from our panelists. Thank you all for taking time to share your insights on this special day. We'll now take a moment to hear a special message from Ahmed Al-Mandari, the Regional Director for the WHO East and Mediterranean Regional Office.
We are committed to supporting member states in the Eastern Mediterranean region to achieve the targets of 2021-2030 roadmap for neglected tropical diseases. Act now, act together, invest in NTDs.
À l'Organisation mondiale de la santé, nous nous engageons à soutenir nos États membres afin qu'ils puissent atteindre les cibles de la feuille de route 2030 des maladies tropicales négligées. Agissons maintenant, agissons ensemble et investissons dans la lutte contre les maladies tropicales négligées.
The Regional Director, followed there by Yvan Houtin, the Director of Universal Health Coverage, Communicable Diseases, also at WHO Eastern Mediterranean Regional Office. Thank you both for your continued commitment towards eliminating NTDs and achieving the roadmap targets. Now, there are numerous benefits in creating and maintaining meaningful partnerships and collaborations, and they're all well documented, new ideas, novel solutions, increased productivity and problem solving. And on a celebratory day like today, it's just hearing from partners across the globe. I saw some of the messages, people just saying, hello, friends. And you are old and new friends of the NTD community. It just brings a renewed sense of focus and solidarity. Just watch this.
Les maladies tropicales négligées touchent plus de 2 milliards de personnes dans le monde, dont 40% sont localisés en Afrique. Le Sucre Africa et ses partenaires s'engagent davantage à atteindre les objectifs de la feuille de route de l'OMS 2021-2030.
Core NTD and the NTD Support Center are honored to be part of the NTD community of partners working to eliminate NTDs. This World NTD Day, we pledge to support the research that's required to end the neglect.
At the NDI, we are committed to develop treatments that meet the needs of communities affected by neglected diseases. By innovating together, we can achieve WHO's NTD Roadmap 2030.
The Neglected Tropical Disease Roadmap 2030 calls for stronger accountability for strengthened response to neglected tropical diseases. At the African Leaders Malaria Alliance, we are committed to accelerating this through high-level engagement and the use of neglected tropical disease scorecards for accountability and action.
Whether we're in Atlanta or out here in the world, like we are in Sudan, the Carter Center is committed to battling neglected tropical diseases.
Central to the Global Schistosomiasis Alliance is our firm belief that by working together, we will reach our elimination targets sooner. We unite stakeholders at all levels to increase commitment, knowledge, and long-term investment, much needed long-term investment, to achieve elimination of this debilitating disease. Let's seize the opportunity now, quicken the pace, and help countries reach the NTD roadmap targets.
In Mundo Sano, we stand for equity, and health for all is a first need for equity. We are completely aligned with the roadmap of WHO. We believe, we trust in WHO leadership.
Registered Development is proud to support the WHO roadmap through the FGS Integration Group, or FIG, strengthening connection between women's health and neglected tropical diseases, and also championing the elimination of the skin NTDs in collaboration with communities and national programs.
Here at the International Society for Neglected Tropical Diseases, we're very happy, we're very honored to be joining the global community in celebrating the World NTD Day. We reaffirm our commitment in the fight against these diseases and to raising the many, many voices working together.
At WHY-HER, we are committed to overcoming the gender equity and social inclusion related barriers to achieving the control and elimination of NTDs. This World NTD Day, WHY-HER solidifies that commitment.
American Leprosy Missions is committed to the WHO 2030 NTD Roadmap. Join us in breaking barriers to health and renewing hope.
I'm Captain Monica Parise. The U.S. Centers for Disease Control and Prevention remains committed to working with global partners to develop new approaches and diagnostics to help end NTDs and promote global health equity.
On behalf of the communities we serve in 27 countries and the philanthropists who generously support NTD elimination through the End Fund, we commit to the WHO 2030 Roadmap goals. Every investment we make is a co-investment with our government partners.
Did you know that Indonesia has the third highest number of people diagnosed with leprosy each year? I am Marloes Gijzen, a dermatologist from Okru, Indonesia, and conduct clinical and social research to improve the diagnosis and treatment of leprosy.
The U.S. Agency for International Development is proud to be working alongside over 30 countries in their fight against neglected tropical diseases.
Sightsavers is fully committed to NTDs, and we're committed to the WHO roadmap, which shows the way. We've been working in this sector for decades and much more is needed to be done.
At the Royal Society of Tropical Medicine and Hygiene, we've been dedicated to fighting NTDs for many decades. We're proud to be part of the community on this World NTD Day.
CWW aims for a world free of intestinal worms. Through guidance and goodwill, we commit to building the capacity of global health programs to meet the 2030 STH targets.
The NNN's working groups and annual conference bring diverse communities together to foster cross-sectoral collaborations to beat NTDs.
In 2022, about 8,400,000 people in South Sudan were in need of treatment for at least one neglected tropical disease. This figure is about 76% of the total population and about 98% of rural populations, making South Sudan one of the world's neglected tropical diseases most burdened countries. At Landos, we are 100% committed to zero neglected tropical diseases.
At Visual DX, through the project of Impact NTD, we're working to accelerate the decentralization of skin NTD care to the primary health care level units by leveraging artificial intelligence for the diagnosis and management of skin NTD.
In Ethiopia, we are tackling podoconosis, a debilitating neglected tropical disease. Alongside partners, we are integrating NTD diagnosis and treatment into primary health care and helping to empower those affected to improve their own health, social bonds, and economic status. Malaria Consortium is committed to the NTD roadmap.
GSK is 100% committed to ending neglected tropical diseases. Since 1999, we have donated over 11 billion doses of our medicines. With our partners, we remain committed to achieve WHO 2030 goals of eliminating NTDs.
Tropical Data is committed to the NTD Roadmap 2030, supporting health ministries with surveys to track progress towards their NTD elimination goals.
At ANSVAT Foundation, we are committed to the elimination of skin NTDs and its 2030 roadmap. We act and invest in partnership with an important network of organizations whose mission, like ours, is to put an end to these neglected diseases. Our joint efforts are vital to the achievement of our common goal.
The International Coalition for Trachoma Control is committed to collaboration and partnership to deliver the goals of the NTD Roadmap 2030, including the elimination of trachoma as a public health problem by 2030.
At SCI Foundation, we're committed to delivering the NTD vision by aligning our new strategy to the 3 pillars of the roadmap. We strongly believe this is how we can support progress on the SDGs and UHC.
The Fred Hollows Foundation is pleased to join the World Health Organization in celebrating World Neglected Tropical Diseases Day. We're committed to tackling neglected tropical diseases, especially the painful blinding disease of trachoma. This ancient disease needs to be eliminated, and we know how to do it.
We are 100% committed to ending NTDs, working with members and partners here in Canada
and around the world towards achieving the WHO NTD Roadmap 2030 goals.
I evaluate interventions that aim to mitigate NTD-related stigma in order to suggest optimal strategies to improve the lives of affected individuals. I'm committed to fight NTDs.
The WHO NTD Roadmap highlights that diagnostic testing is fundamental to beating NTDs. FIND remains committed to working with partners to accelerate development of new tests, improving access to the ones that we already have, so that everyone can get treatment when they need it and decision makers can direct health resources effectively. We need new innovations, new financing mechanisms, and new partnerships
to defeat these devastating diseases.
It's been a privilege to lead Ghana's development of our Zero Leprosy Roadmap and Action Plan, which align with the WHO NTD Roadmap. The Global Partnership for Zero Leprosy is fully committed to the WHO NTD Roadmap.
यही आउँदो उपेक्षित उष्ण प्रदेशीय रोग दिवसको अवसरमा म यहाँहरू सम्पूर्ण सरकारवाला निकायहरूलाई यस रोगको अन्त्य र नियन्त्रण गर्नको लागि ठोस कदम चाल्न हुन हार्दिक अनुरोध गर्दछु।
At the NTDs, the German network, we will continue our activities to bring together German and international stakeholders.
It's essential that we act together to accelerate innovation and access of safe, affordable, and effective health technologies for NTDs. UNDP and the Access and Delivery Partnership stand with WHO and other partners to fight against neglect.
As part of our enduring commitment to NTDs and our pledge to the Kigali Declaration, Johnson & Johnson is working from the lab to last mile to fight the impact of NTDs such as STH, dengue, and leprosy.
We need more collaboration and more investments to tackle NTDs, which have such devastating consequences for more than 1 billion people all over the world. We at Merck contribute to the WHO NTD roadmap by continuing to deliver up to 250 million tablets per year for the treatment of schistosomiasis, and we also develop new drugs and diagnostics. A world without NTDs such as schisto is possible.
We at Youth Combating NTDs are committed to the WHO roadmap on neglected tropical diseases.
The task force has been working to beat NTDs for almost 40 years. We're committed to the NTD roadmap, so act now, act together, invest in NTDs.
It really is so heartening to hear how partners across the globe are committed to this journey to eliminate NTDs by 2030. A very special community indeed. Now, commitment and cohesion is necessary, as is the mechanism to mobilize and track progress. Formally launched in June of last year at the Kigali Summit on Malaria and NTDs, the Kigali Declaration on NTDs is a high-level political declaration that is mobilizing political will, community commitment, resources, and action, and securing commitments needed to end suffering caused by NTDs. It has already galvanized the largest collective financial commitment towards NTDs to date. As of January 2023, more than $1.6 billion and 19 billion tablets have been pledged. These commitments are helping to create the much needed momentum to deliver the targets set out in the WHO NTD roadmap, as well as achieve Sustainable Development Goal 3. Let's find out more.
The Kigali Declaration on Neglected Tropical Diseases is an exciting, high-level commitment to end NTDs once and for all. Leaders from around the world are signing the declaration, mobilizing the political will, community engagement, resources, and action needed to stop suffering caused by these diseases. From financial commitments to drug and diagnostic donations, to technical assistance and supportive policies, each signatory makes a unique and vital contribution towards ending NTDs. Collectively, these will translate into incredible progress being made. With countries leading the way, international targets are embraced and translated into national strategies, leading to impact and progress. The actions set out in this powerful declaration will help us achieve the target for NTDs set out in Sustainable Development Goal 3 and deliver against the World Health Organization's NTD roadmap. We thank all partners who have made commitments so far, and we call upon our fellow global leaders to show they are 100% committed, to endorse the Kigali Declaration, to unlock the potential to end NTDs, to change the lives of billions of people globally, and to build a stronger, healthier, safer world. Let's act now, act together, and invest in neglected tropical diseases.
And today on World NTD Day, Uniting to Combat NTDs is delighted to share new endorsers and commitments to the Kigali Declaration. At this juncture, though, I'd like to welcome Honourable Minister Mahama Seini, who's the Deputy Minister of Health in the Republic of Ghana, to share a few words.
Good afternoon, ladies and gentlemen. I am Honorable Alhaji Mama Seini, Deputy Minister of Health of the Republic of Ghana. Honorable Ministers, distinguished guests, ladies and gentlemen, the media. I am delighted to be joining you today in celebration of the World NTDs Day. Ghana is proud to have been dedicated by the World Health Organization for eliminating sleeping sickness just in the last few weeks, bringing to 3 the number of neglected tropical diseases Ghana has eliminated. Please join me in paying tribute to all the health workers and partners who have contributed to this success. Whilst we stand here in celebration, we should not lose sight of the fact that there is yet more work to be done if we are to achieve the SDG targets for neglected tropical diseases and the World Health Organization Neglected Tropical Disease Roadmap. We need more countries to step up and invest in neglected tropical disease programs. This is why Kigali Declaration on Neglected Tropical Disease, recently launched by heads of states in Kigali, is so important. Today, Ghana has joined leaders from around the world in endorsing the Kigali Declaration on neglected tropical diseases. As a nation, we commit to strengthening our efforts in fighting these diseases and contribute to an African free from the burden of neglected tropical diseases. Signing this declaration, we committed ourselves to continuing to implement strategies that will lead to the elimination of many more neglected tropical diseases in our country. We believe that this is a critical step towards building a healthier and more prosperous nation for all of our citizens. On the recent endorsements of the Kigali Declaration of the elimination of neglected tropical disease and malaria, on behalf of the President of the Republic of Ghana, His Excellency Nana Addo Akufo-Addo, I wish to make a short statement.
Neglected tropical diseases cause immense suffering. In Ghana, to have been the first country in Sub-Saharan Africa to have eliminated trachoma. We have also eradicated guinea worm disease from our land. Further, we are on the brink of eliminating sleeping sickness and leprosy. Investing in NTD elimination programs creates a ripple effect in society. It leads to better education, health, and employment outcomes, and transforms lives and our communities. It helps to reduce gender inequity and stigma. That is why I'm proud to endorse the Kigali Declaration on Neglected Tropical Diseases. An Africa free from NTDs is possible. Let us act now and act together. Ghana is 100% committed to ending neglected tropical diseases.
High-level commitment that supports in-country programs is vital. Thank you to President Akufo-Addo for that message of continued support. We'll now hear from Tijana Williams, Director of the Albendazole Donation Program's Global Health Access at GSK.
I'm really pleased to announce that GSK is further extending our donation commitment for soil-transmitted helminthiasis to 2030. a disease which affects millions of children per year, predominantly from the most underserved communities. Alongside an ongoing commitment to donate our medicines until lymphatic filariasis is eliminated as a public health problem everywhere, we will donate up to 100 million doses for STH per year from 2026 to 2030. At GSK, we remain 100% committed to ending NTDs in alignment with the WHO roadmap. Thank you.
Thank you so much, Tiana. Next, the U.S. Agency for International Development is one of the major donor agencies supporting NTD programs. Let's listen in to what Rob Henry, the Senior Public Health Advisor for NTDs, has to say.
Hi, I'm Rob Henry with the U.S. Agency for International Development Neglected Tropical Disease Program, Office of Infectious Disease, Bureau for Global Health. While incredible progress has been made, there is still more to be done to beat NTDs. The United States government, through fiscal year 2023, has appropriated $114.5 million towards ending NTDs. This support, through the U.S. Agency for International Development and partners, will help countries to continue their efforts to control and eliminate NTDs, while bolstering operational research, diagnostic research and development, and sustainable health services. Thank you.
And thank you to partners at USAID. It is through strong learning partnerships that we can really elevate the commendable ongoing efforts of the NTD community. And now we'll hear from Stuart Halford, Director of Resource Mobilization and Advocacy at Uniting to Combat NTDs. He is going to tell us about a new tool to track and monitor commitments. Is that right?
Thank you, Patricia. Yes, it is. And let me start by saying, we also want to wish everyone around the world a happy World NTD Day. I want to start by saying that I'm delighted to share that the ANISPAD Foundation, who have been working to reduce NTDs on a global scale since 1968, have signed the Kigali Declaration on NTDs to mobilize 34 million euros until 2026 to reduce the burden of skin NTDs in Sub-Saharan Africa. These new commitments are to be celebrated. However, we can't stop here. Uniting to Combat Neglected Tropical Diseases continues to welcome endorsements and commitments for the Kigali Declaration. More resources are needed, and if we are to reach the targets of the WHO 2030 NTD roadmap and safeguard the hard-won gains of the past decades. Finally, today, the Kigali Declaration Commitment Tracker has been launched. This is a new online tool to capture, track and monitor commitments made as part of the Kigali Declaration on NTDs in order to deliver the WHO roadmap. And this tool represents a major step forward in our ability to better understand the current funding landscape for NTDs and more effectively address shortfalls and gaps. And by publishing comprehensive information on committed resources, the tracker is able to provide a new level of transparency that will enable us to hold each other accountable and effectively mobilize new resources that are required to end the suffering caused by these diseases. And to learn more about the Kigali Declaration on NTDs and to see the commitment tracker, I urge everyone to visit the Uniting to Combat NTDs website, which is at unitingtocombatntds.org. Thanks.
Thank you so much, Stuart. Great to hear about the Kigali Declaration Commitment Tracker there. Let's now listen in to a special message. Continuing with his steadfast support of the NTD community is the World Health Organization's Director General, Dr. Tedros Adhanom Ghebreyesus.
Around the world, neglected tropical diseases or NTDs afflict more than 1 billion people, trapping generations in cycles of poverty and stigma. But in recent years, neglected tropical diseases have become just a little less neglected. Over the past decade, the number of people requiring treatment for an NTD has dropped by 25%, and 47 countries have eliminated at least one NTD, including 8 countries last year alone. But we continue to face many deep-rooted challenges which have been compounded by the COVID-19 pandemic, including securing sustainable funding to deliver NTD programs in countries. In 2021, WHO launched a roadmap for NTDs with global targets to prevent, control, eliminate, and eradicate 20 NTDs and disease groups. We need everyone's support to accelerate towards those targets. Investing in NTDs is not just an investment in fighting single diseases. It's also an investment in water, sanitation and hygiene, vector control, One Health, stronger health systems, universal health coverage, and the fight against poverty. Today, on World NTD Day, WHO's message is clear. Act now. Act together. Invest in NTDs.
Reiterating the importance of funding partnerships and the critical tie-in to delivering on a number of United Nations health goals. Thank you to Dr. Tedros for always taking time to share his thoughts with us. Now, ensuring the needs of the people living with NTDs are met, we must keep their voices and hopes close. Let's now listen in to Tijani Salami in Nigeria, Joanna Gomez de Araujo from Brazil, Silifat Abdul Ganiu from Nigeria, Prima Garti Magar from Nepal, and Benjamin Kasamila from Ghana about what a community without NTDs would look like.
I'm Tijani Salami. I'm a physician by training in Nigeria in one of the rural hospitals. I myself am a sufferer of this disease. This disease has rendered many people very incapacitated. Then they have become debilitated. They have lost their means of livelihood. You will see that my community will be free of all this discrimination if there were no neglected tropical diseases among those people. So I'm 100% committed to see the end to this kind of diseases.
Meu nome é Joana Gomes de Araújo, tenho 55 anos, sou natural da cidade chamada Timbaúba. Atualmente eu moro numa cidade chamada Maraial. A doença de Chagas veio por volta da minha adolescência, onde veio de uma forma crônica, onde coloquei o marca-passo, aonde assim as pessoas não têm o atendimento necessário. Estou 100% comprometida em acabar com a doença tropical negligenciada no mundo.
Sunana Silfat Abdulgani, ina jega jan kabi. Tun san da nika mafawa ga kawanga, tun san da aka bani bayani kamar wanda zan dan kula da shi, ina jin soki abubuwa abin da ban yi da ina ganin yanzu ina yi don ina samu soki ko cikin tahiya ina yin tahiya da dama. Abin da naka sa rayuwa na fata na ga rayuwa na lahiya zan samu da karfin shi. Asibiti sai mutum ya ansa yi amfani da shi, a kula da ruwa wanda aka sa gwamnati dai ba mu ruwa, mu dan dibi ruwa na kwarai wanda za mu dan sa zai zama abin cuta.
Special greeting to you all from Ghana. My name is Benjamin Nkansamila. I found a little spot on my leg, but I could not took it seriously. 3 days later, when I was crashing, I found it very hard and very painful to my body. Later, I found a big sore on my leg that I could not manage to do anything. Due to the help of the doctors, I am now okay. I can go anywhere. I can even play football. I can even dance. Even I have a family.
नमस्ते, मेरो नाम प्रिमा घरती मगर हो। म नेपालको एक विकट गाउँ रोल्पा जिल्लामा जन्मिएको थिएँ। हाल म 41 वर्षकी भएँ। म एक कुष्ठ प्रभावित महिला हुँ। मेरो परिवारमा म लगायत मेरो बुवा र हजुरबुवा गरी हामी 3 पुस्ते नै कुष्ठरोगबाट प्रभावित हौँ। म 11 वर्षको हुँदा मिसन अस्पताल दाङ लगिएको थियो, जहाँ मलाई कुष्ठरोग लागेको पुष्टि भयो। सोही अस्पतालबाट मैले उपचार गराएँ। उपचारमा लागिरहँदा पढाइ छुट्यो र 21 वर्षको उमेरमा मात्र पहिलोचोटि विद्यालय भर्ना भएँ। पढाइलाई निरन्तरता दिई हाल म असिस्टेन्ट फार्मेसीको रूपमा आफ्नै सानो औषधि पसल चलाई जीविका चलाइरहेको छु। मेरो पनि अन्य साथीहरू जस्तै हाँस्ने खेल्ने साथीहरू हुने थिए, समयमा विद्यालय जान पाउने थिए। मेरो समुदाय बेग्लै हुने थियो। त्यहाँ रोगसँग सम्बन्धित कुनै घृणा हुने थिएन। मानिसहरू बीच आपसी सद्भाव हुने थियो। म यस्तो खालको नेग्लेक्टेड ट्रपिकल डिजिजको अन्त्यको लागि 100% कटिबद्ध छु। धन्यवाद।
Yes, their voices represent the hopes of countless people envisioning a world without NTDs. Now, thank you to all the panelists and, of course, to the global NTD community for their inspired level of commitment. We celebrate you all today for the significant achievements gained during uncommon and challenging times and for the unwavering and invaluable dedication to the ongoing work. Now, as we wrap today's celebration, we leave you with a few special videos highlighting some of the ongoing work. But for this, I'd like to invite back on screen Dr. Fall.
Thank you, Patricia. It's my great pleasure now to announce the launch of the GON network to address the challenges and opportunities and to move forward with critical actions in the elimination of onchocerciasis. WHO member states and partners have established a new global onchocerciasis network for elimination, referred to as GON. To strengthen partnership and communication and to assist member states in achieving the 2030 roadmaps on onchocerciasis elimination goals. The network will enable countries, representative programs, and partner organizations to work together to ensure onchocerciasis is gone soon. In a moment, we will see a video about the new GON network, as well as videos on multi-sectoral approach to vector-borne diseases. Another video will mark World Leprosy Day 2023, which was celebrated yesterday. And lastly, the slide will end the webinar with the provisional Guinea number for 2022. Before that, though, I would like to take this final opportunity to thank everyone for joining today and for your unwavering commitment to a world free from NTDs. Thank you so much.
Thank you, and thanks once again for joining WHO and uniting to combat NTDs on this very special occasion. Enjoy the rest of your day. Bye-bye.
Bye-bye.
Introducing the multi-sectoral approach to vector-borne diseases, because VBDs cannot be addressed by the health sector alone. Why do we need a multi-sectoral approach, or MSA? Despite significant progress, vector-borne diseases, or VBDs, are still responsible for more than 700,000 deaths globally per year. VBDs are notoriously complex to address. They are spread by vectors, mainly insects and ticks, transmitting pathogens such as viruses, bacteria, and parasites. This means VBDs are strongly influenced by environmental factors such as climate change and anthropogenic factors such as economic and social issues, including population displacement. Because VBDs are influenced by multiple factors, their management and control cannot be achieved by the health sector alone. This is the motivation behind the multi-sectoral approach, which brings together stakeholders from various sectors to tackle VBDs using shared knowledge, resources, and tools. The aim of this collaboration is to reduce the impact of vector-borne diseases by reducing exposure and strengthening the health system. But an effective MSA must also benefit the other sectors involved, therefore enhancing collaboration and trust. How do we build an MSA? An effective MSA is made up of 3 components. The base comprises 3 pillars: commitment of leaders, coordination of work, and community engagement. The technical elements drive meaningful engagement through joint activities and between different domains. The energy elements help to mobilize partners and pool resources, from human and financial to policy and legal support. To be successful, an MSA must also be tailored to the local context. Just one example is the Henan malaria elimination plan in China, which used a multi-sectoral approach to bring together sectors such as trade, tourism, finance, health, telecommunications, and education. Through this collaboration, malaria elimination was achieved across the province in 2020. What next? To continue the fight against VBDs globally, we must work locally to implement meaningful MSAs that accelerate progress and save lives.
I was diagnosed with Hansen disease, leprosy, 4 years ago.
I experienced Hansen disease when I was very young.
I was diagnosed with leprosy at the age of 8 years.
म चाहिँ सानै उमेरमा 11 वर्षको उमेरमा मलाई कुष्ठरोग.
My grandmother was affected. My parents too.
I was ashamed. I was depressed.
लागेको थियो र 4 वर्ष ट्रिटमेन्ट गरे. ट्रिटमेन्ट लेभलमा धेरै स्ट्रगल गर्नु पर्यो किनभने मेरो परिवारले
The villagers won't try to, talk with us. They won't come near us.
The late diagnosis mutilates and causes the affected persons to have physical impairments.
I also reached very late to the hospital because there was not much awareness about the disease in my family, and that causes deformity in my hand.
ये बीमारी के बारे में माहिती नहीं थी, इस कारण हाथों पैरों में विकलांगता आ गई.
In Maradi, where I grew in the community of persons affected, I saw people suffering from stigma, suffering from discrimination.
मैले जति दुःख गर्नु गरे, दुःख पाउनु पाए, म जस्ता मेरो पछाडि आउने कुष्ठ प्रभावित दाजुभाइ दिदीबहिनीहरूलाई, विशेष गरी दिदीबहिनीहरूलाई अगाडि बढ्नलाई, अगाडि आउनलाई